The evolution of nursing informatics. Project presented by Grace Dinger on 5/28/2025. Nursing informatics belongs to nursing and uses principles from nursing, computer science, and information science. The major goal of informatics is to oversee and transmit data, information, knowledge, and wisdom used in nursing setting. EHR software helps clinicians provide better care to patients by helping with choices for care, improving records, and making process more efficient with the help of EHRs, computerized medical advance, and mobile device. Nurse can safely, efficiently, and scientifically care for patients. The use of technology in nursing links different teams help make sure patients recover well and guarantees coordinated care for everyone involved. Advanced registered nurse leaders should learn about nursing informatics to manage changes in digital health and back initiative to use technology in healthcare settings. During the late 1960s and early 70s, nurses began using technology to document in hospitals and find deficient ways to collect information. When computers were easier to use, nurses began using them for patient data management and did their work more effectively. In the late 1980s, the ANA and several other organizations began setting up and explaining the new field called critical care nursing. The American Nursing Association made nursing information a nursing specialty and published its first set of practice standards in 1992. The field began adding structure, recognizing experts more, and creating new employment opportunities after acknowledging nurse informatics as soon as the internet and EMRs were introduced in the 1990s and 2000s. The new technologies made it possible for the field to develop and embrace EHR's decision support and telehealth. With the advance in technology, nursing informatics started to include live data analysis, tools for predictions, AL, and guiding medical decisions. Such tools support nurses and other medical staff by helping them decide what to do. Spot signs of risk, for patient and enhance patient care. Apps for mobile devices, smartwatches, and telehealth have come to help, allowing people to monitor their health from a distance. Informatics systems have started to assist with quality care improvement, looking after population health and offering tailored medicine. In nurse, informatics is essential in designing, putting into practice, explaining how to use and assign information system. Through nursing informatics, nurses manages uh, mm, nur- nur- through nursing informatics, nurse managers are able to rely on data to direct their effort and control challenging healthcare work settings. Thanks to performances dashboard, result of clinical treatments, and information on patient safety. Nurse leaders are able to judge the quality of care, spot developments, and put in place helpful improvements. Leaders use informatics tools to monitor staff performance, distribute resources appropriately, and make sure everyone adheres to the goals. In addition, information technology support network among healthcare workers by putting all patient data in one place. It is up to nurse leaders to push for the use of updated health IT and make sure the tools are easy to work with and fit the needs of those providing nursing care. They have a role in shaping policies and supporting things that improve how work gets done and care is delivered. Nursing informatics has made patient care more accurate and faster because EHRs can be used in real time. Nurses can access and update patient details safely and share them with the whole team. Using special software, nursing gets suggestions and reminders that match correct scientific research and help them prevent errors. Point of care technology, together with mobile equipment, help nurses achieve timely care for their patient as it lowers their paperwork and related duties. With informatics, care for people with several conditions can be managed more easily by different providers. When all documentations is standard and electronic protocol are used, care is given in the same way from the start to the finish. In administration, nursing informatics is important for efficient use of resources, correct budget management, and enhancing the organization performance using informatics, nursing administrator duty, how patient may be planned, staffing properly and ensure the right assortment of nurses in each unit. Analysis of data helps with choices about finances, risk control, and operating success. Informatics make it possible for administration to track rules and requirements, check how patients are satisfied, and study quality indicators so they can improve the services and guide the organization. Informatics allowed administrators to monitor results in the moment, adjust practices ahead of problems, and support action that make care better. Nursing informatics has made a big impact on education at all levels. Academic curricula for nursing now teach students the informatics skills they will need in technology-based clinical setting. Training with equipment found in simulated labs, virtual system, and EHR tools teach how to handle real cases. Teachers use informatics to track students' progress, provide talkative content, and offer support to distance learners. Thanks to informatics scientific studies and best practice guidelines can be included more efficiently in teaching. For registered nurses, having informatics helps them participate in webinars, signs up for online classes, and learn through management systems. It helps by creating unique teaching materials that respond to what students need and the duty of their role. Through the collection, handling, and examination of complicated health information, using informatics help propel nursing research, review data in big medical medical database, and use EHRs to observe pattern, locate trends, and judge patients outcomes. Thanks to informatics data, meaning and satis, um, statistical analysis becomes more efficient for nurses, providing them with important evidence for use in health practice and shaping policies. Besides, informatics help establish registered registries, research protocol, and tools for sharing data, which support network among various organizations. Accessing data in real time helps make research finding quicker and more important. Informatics support this kind of research by converting discoveries from academic settings into helpful tools used by clinicians. As informatics is applied to research, nurse researchers can identify what patients need, assess solutions, and create new ways to make care and health better for all. Health information system within organizations should be consistent with government laws that protect a patient's privacy and keep data safe. The guideline of HIPAA and HITCTECH required businesses to handle data electronically following certain rules. This guideline determine the method health system use to implement EHRs, decide who can use them, and protect sensitive health information. Furthermore, CMS progressed like the promoting interoperability effort motivates hospitals or use certain EHRs for better patients rules. Nurse leaders are responsible for meeting regulations and lobbying for improvements that increase clinical quality. Any policy created within an organization should cover training, security measures for cyber risk, data controls, and how patients are involved. Bringing their experiences to the front line, nurses inspire changes in informatics as they help build and put new technology in place. Through certain contacts with patient and their surrounding, nurses easily discover where changes are needed and suggest them. Some nurse-led ideas are creating decisions aids that work for particularly group, improving the interface of electronic health record, and offering support apps for managing lead health problems. As a result, patients get better care, nursing experiences improved network, operation and clinicians suffer less from burnout. In numerous organizations, informatics helps bring changes by staff working together with um, with specialties administrators and frontline workers, mixing scientific healthcare with the benefits of technology helps nurses improve patient care. When raw data is used in nursing informatics, the outcomes are actions that better patient care. An example is the way predictive analysis looks for patients who might need to return to the hospital soon after being discharged. Nurse informatics bring out information from EHRs that relates to homo, homo, comorbidities, the use of prescribed medication, and what effect each patient held at home or in society. Step like care coordination, special appointments after discharge, and home care can then be applied to keep readmission from happening. BCMA is another way that medicine is safely and accurately given to patients as it should be. BCMA decrease mistakes in medicine and help keep patients safe. Though informatics nurse monitor health wounds, use mobile health app for chronic illness care, and check vital signs from afar. Nursing informatics is an essential and fast-changing part of today healthcare. It manage what happens in the hospital with advances in information technology, helping nurses provide better, safe, and relevant care, more relevant care. With time, nursing informatics has added advanced analysis, artificial intelligence, and new kinds of technologies that support patients to their main functions because it is used in leadership, administration, clinical practice, education, and research. It has become crucial for healthcare today. Adopting information given advanced requested nursing leaders what they need to effect policy, guide changes based on evidence, and managing improvement within an organization. Process in health information technology led by nurses is leading the future of healthcare and organization. Nurses as experts in both fields. This is the end of the presentation.